What is the difference between the subfascial breast implant pocket location or the dual plane submuscular pocket location? Let's talk about it. My name is Dr. Jules Walters. I'm a board certified plastic surgeon, and let's first talk about the dual plane submuscular approach. So for the last 11 years in practice, my most preferred pocket location for most breast implant patients has been half under the muscle or the dual plane submuscular approach. And it's for a lot of reasons. So to date, capsular contracture rates appear to be lowest in the dual plane or the submuscular approach. Now, there is new data that is challenging those statistics, but I think it's too early to really tell. I also like the dual plane or the submuscular approach because it provides more padding to the upper pole of the implant and allows, in most patients, more of a teardrop shape because the muscle pushes down on the round implant. I'm also able to use the rapid recovery technique with my dual plane under the muscle approach. People are still able to recover very quickly within 24 hours when implants are placed under the muscle. Okay, so one concern about the dual plane or the submuscular approach is something called animation deformity. And this is when the pectoralis major muscle actually contracts against the breast implant. In my experience, animation deformity affects a small minority of patients, but if it is a concern, then we do talk about the subfascial approach. Okay, so the subfascial approach is actually placing the implant under the breast gland on top of the muscle, but under a thin layer of what we call fascia of the pectoralis muscle. Who are the best patients for the subfascial location? I think patients who naturally have a wide gap and they're looking to narrow that gap and get the best amount of cleavage with breast implants, the subfascial location can be an excellent option. I think also patients who are fitness instructors and bodybuilders who are constantly utilizing their pectoralis major muscle with certain exercises, and we don't want to distort the implants, then the subfascial location can be excellent for them as well. I think for all patients, having enough tissue over the implant is important to prevent and minimize things like rippling, but that seems to be less of a chance with the newly cohesive implants. I clearly perform both the dual plane submuscular pocket locations for breast implants as well as the subfascial location, and I think it really depends on each patient's unique anatomy and what are their goals for breast augmentation surgery. Breast augmentation surgery is not a one-size-fits-all operation, and each surgery has to be customized for you and for the goals that you're looking to obtain.